Good afternoon, everyone. We'll go ahead and get started here in just a minute. All right, seeing that we're at the top of the hour and we want to use time efficiently, welcome. Good afternoon to the National Center for Healthcare Leadership's Coffee Chat. Today's presentation will highlight the trends AON is seeing after conducting their annual hospital benefit survey. My name is Megan Nussain. I'm the Senior Director of Communications and Development with NCHL. Before we get started on today's discussion, I have a few housekeeping updates. First is if you have a question or comment for the panelists during the presentation, feel free to put those in the Q&A section. We're going to try and hold time for questions at the end of the presentation, and we'll do our best to address them. And if we're unable to, Sheena, Frank, and I will try to follow up with you offline. Additionally, we're utilizing Zoom and have enabled the closed captioning. Should you wish to enable your own closed captioning during the event, please click the closed captioning button on the bottom of your Zoom window. Finally, it's come to our attention, as most of you, that in the next 20 minutes during the live recording of this webinar, starting at approximately 2:20 Eastern, the federal government will be conducting a nationwide test of its emergency alert system and wireless emergency alerts. The tests will send emergency alerts to all consumer cell phones, radios, and TVs. Essentially, what this means that you can expect hundreds of millions of cell phones around the country to make a screeching alert noise at approximately the same time today, beginning about 2 o'clock, 2:20 Eastern. For that reason, I've asked our panelists to turn off their cell phones during this webinar, and I only call it to your attention for our attendees, so you're not startled during the webinar by your own cell phones. So now, without further ado, I'm pleased to introduce today's speakers, Frank Leonardo, Health Solutions Leader, Healthcare Industry Practice at AON, and Sheena Singh, Senior Vice President, National Healthcare Industry Practice at AON. Sheena and Frank, I'll hand things over to you. You should have complete screen control now, Sheena.
Great, perfect. Thank you, everybody. Thanks, Megan, for the introduction. As Megan said, we're really looking forward to sharing our preliminary results for the 2023 AON Benefits Survey of Hospitals. And I'm going to have Frank kick it off and talk about our healthcare practice at AON, as well as what the survey entails.
Good day, everyone. I just wanted to provide you an overview of our healthcare industry practice. Our healthcare industry practice at AON spans across our human capital and risk management solutions. We assist our clients using innovation, information, and our experience to meet our clients' needs. We have over 300 clients, all with a unique perspective of being not only an employer and a provider, and using that to provide some context for today's presentation. As we think about different ways that we inform our clients and the industry, our hospital healthcare industry survey is in its 18th year. The survey includes 160 health systems comprised of 1,400 hospitals representing over 3.3 million employees across the U.S. This survey and the topics covered are a result of the direct feedback from you, the participants, to enable us to provide the information you need to meet your short and long-term objectives. We're just going to be covering a small piece of the survey today. The survey, which is coming out later this month, has over 90 pages of information. So just to pull back a moment and think about the key areas and the key trends and areas of focus that our health systems clients are facing, and the things that really come to light in the survey. One thing, as we start on the bottom, what's the environment? We still see significant financial headwinds coupled with labor shortages, inflation, lagging volumes, labor strife that continues as we're on the eve of some large strikes as actually this week. As we think about areas that we're going to cover today, and again, top of mind, attraction and retention is at the top of the list, and thinking about the tactics that groups are utilizing to alleviate those concerns, and then looking at leveraging rewards and responding to talent challenges. As we see different things evolving across as we go through some of the results, how groups are meeting and investing in total rewards. After an unprecedented in the last 3 years, we've seen so much investment by organizations, and again, groups trying to utilize information to create the right balance between the different elements of total rewards. And related to that, understanding what employees value. We see a lot of attention being paid to, after the unprecedented changes, either direct compensation or increasing benefits or additional time off, looking at, and Sheena will review, what are the types of feedback mechanisms groups are utilizing to gain better insight of what is really driving the employees to stay, and what are the things driving new employees to enter the organization. So a real focus on that as well. And then the managing of the total rewards, as I stated, we're economically, groups, even though we've seen some improvement in margins as we think about 2023 compared to 2022, we're still in an extremely tight economic situation. Many systems, health systems, with either very small margins or having negative margins. So really looking at how do you optimize the spend as you continue to a lot of investment in the compensation components. How do you match the employee benefits? And recognizing that much of how benefits, the largest benefit being health benefits, and related in terms of productivity, so much of that is happening in the delivery system. So that activation. And last, the different types of offerings as it relates to new and arising things that we'll talk about. We've seen large growth in remote and hybrid work, something that was literally non-existent for most health systems across the country, really enter into the equation, and how groups are reacting to that. And last, burnout and workforce resiliency across multiple spectrums. Again, gaining that insight and understanding what is driving it, and then what can you provide inside and the outside of the health system to meet those not only health needs, but also overwhelming on the financial sense as well. Right, so as we think about the top concerns, so as we look at this slide, as we asked the participants in the survey, what would you list as a top concern? Something on a scale of 1 to 5 that was either a 4 or a 5. So as we think about the bar chart on the right, and then the small corresponding numbers on the first 10, that shows how much did that change from 2022 to 2023. So as I look at the top concerns, and many of which are probably no surprise to the people attending this, certain things, I look back at 2019 to see what were the top concerns there, and it's surprising to see that some of the 3 of the areas in the top 10 did not even exist in the top 20. Were not appearing as a concern in the top 20 as we did the survey in 2019. That included access to mental health providers, burnout and resiliency, and employees understanding the value of their benefits. So rapidly changing dynamic. And you can see from year to year, even from 22 to 23, the number 3 on the list, increasing healthcare costs for the health system. Healthcare costs consume so much of the total rewards package, and it really dropped down on the list in the last few years where there was an unprecedented investment and not looking to change anything as it related to employee benefits. And now that becoming a top concern as the investment on the direct compensation side, some way to alleviate that. And I'll speak as we go through this, to the area of like, how much do you think about that? Because again, so much is within the system. So when CFOs are asking to take money out of benefits to fuel compensation, it's really an inward look, and we'll go over some of those components later. And then, what are the top areas when we ask the HR executives, what are the top areas to retain employees? And again, some of these are no surprise. You look at annual compensation adjustments, one-time compensation adjustments, but some things that are coming to bear. Increased flexibility. It could be scheduling, but also remote. Really, we have health systems that we meet with where clearly have a clear path to saying we were going to have 20, 30, 35% of our workforce outside of our direct area, which is a significant change on so many fronts as you think about recruiting and retention, and hybrid work, which is all again having an influence of how not only your compensation structure, leave of absences as you think about different state laws, but also how you deliver benefits, because again, most systems delivering benefits leveraging their own system. Number 4 on the list, generous and flexible benefits. A lot of activity around creating as much flexibility as possible. Not much in action yet, as people are looking to try to create more flexible options to meet not only the different requirements of the different generations, but also we do see groups fine tuning and looking at things such as coming up with different sets of package for different constituencies, like nurses or physicians or advanced practitioners are all examples of people trying to utilize their package in a way that's as flexible as possible.
All right, so I'll take it from here. We also, surveyed the health system organizations to really understand from their perspective, how are they rating themselves and how they support their employees in various areas, health and safety, from a well-being perspective, from a team's perspective in terms of being able to feel like there's a sense of community and an ability to be flexible. The point that Frank raised around being able to work remotely, but still being able to feel connected to the organization. Some of the areas that I really like to point out here, which I think is interesting, is when we think about the total rewards strategy and perspectives that a health system has as they're responding to this. I think the difference in the fact that 69% of health systems feel that their total rewards package meets their employees' needs, and 57% feel that their total rewards package is competitive for attracting and retaining talent. On the other side, only 17% of those same organizations are saying that employees fully understand what their total rewards package is at their organization. So there's a big delta between having a total rewards package in place and feeling like it's sufficient, but then not really knowing or fully contemplating whether the employees value and understand all of the components of that package in the same perspective that the HR leadership is looking for. So I think it's really important to point out that difference. And what we'll talk about and hear from some of the other survey results is how organizations are really trying to address that and get at that difference and delta in between those perceptions. So we took a stab at really better understanding what health systems are doing to understand the employee perspective. So from an employee listening perspective, many organizations are doing those short pulse surveys or asking about total rewards and various other surveys like an engagement survey and getting a perspective on that. But there are a lot of organizations that are starting to do more focused, both focus groups and focused surveys to better understand perspectives of employees on the benefits that they are offered, as well as their overall total rewards package and resources that they're provided. Interestingly, I think one of the areas that we're starting to see more interest in is testing employees' preferences. So do they prefer a more comprehensive caregiver support benefit, or do they prefer having a more comprehensive health plan benefit, and really trying to test those different preferences to figure out where is the weight from employees in terms of what they value the most, and really being able to then use that to come up with the right strategy for the total rewards package moving forward. And I think that's really important to think about, especially as Frank mentioned, the the concern around increasing healthcare costs has become a top priority again. It's really moved up and down over the last few years, depending on which year we're looking at and which issues we're dealing with. But the fact that health systems are really struggling with managing healthcare costs, and those continue to increase, making sure that they understand employee perspectives and what's valued, I think, is really the way to balance that equation of, let's make sure what we're investing in the long term is really going to be valuable to our employees, so we're not putting our dollars into programs that are not going to be as effective to attract and retain the talent that we want within our organization. And then other areas, I think it's clear communication is really important. And thinking about different channels to communicate the value of total rewards and benefits to employees is really critical to the overall strategy. And that can't be emphasized enough. So, health systems are trying to be more creative beyond just, doing those town halls, having on-site counselors, having virtual benefits counselors to talk about the value of all the different benefits, decision support tools so that the employees are picking the right benefits as they're making their selections, so that, again, they are actually getting the value of everything that's offered to them, and making sure they're being navigated to the right benefits at the right time. Because it's great to have a comprehensive well-being program, but if somebody doesn't know how to get to it or get to the right aspect of the well-being resources they need, that can also really diminish some of the value that employers can provide around those services. So to reiterate, we are seeing a focused investment in really understanding colleague needs. It's the other side of the equation is we know, market-wise what's popular and what's competitive, but it's also important to understand internally what your own culture and workforce is driving in terms of value. So let's talk a little bit about some of the workforce strategy changes that we're seeing. Frank hit on definitely some of these at the top. Offering more hybrid working opportunities for employees, having more full-time, fully remote workers within the population, and hiring out-of-area workers. We think about healthcare being local, but a lot of these jobs can be provided remotely and can be provided out of the area. If you think about, administration, about tech, and other things that are going to support the operations of the healthcare organization. So we continue to see an increase in those types of workforce situations. But we're also, seeing an uptick in thinking about employee preferences, even polling employees to understand their preferences. That 30% has come up from the prior year. We saw about 11 or 12%. We're looking at polling their employees to understand their preferences. So that continues to go up, and there's an interest to further understand that. Then the flexibility in the days worked, even flexibility in terms of looking at other opportunities for career expansion or career development. Because as we think about tools to not just, attract people into the organization, organizations are obviously thinking about how can we make sure people stay in the long term, and that we're continuing to engage them in opportunities for them to advance their career and really be able to see their career evolve within the organization and be here in the long term, and be there as mentors down the line for the incoming workforce as well. So there's a lot of contemplation around enhancing the flexibility in how people work, but then also what we can do when they're here to make sure that they're engaged within the organization. I'm going to switch into talking a little bit more specifically about benefits that health system employers have in place and are contemplating having in place to attract and retain their talent. So some of the mainstays that we usually see at the top in terms of offering is tuition reimbursement, an expansion of voluntary benefits that employees can pay for out of pocket, but provide a diverse set of options that people can choose from that are relevant to their needs. Having flexible work options, like I hit on previously, those are all things we've seen at the top of the list in prior years as well. But what's interesting also is in that darker blue, many organizations are making changes around those benefits and modifying them to, one, probably be more competitive, potentially with other health systems in their area, or making sure, again, they're looking at their policies or their programs that are in place so that it is as inclusive as possible, that they're looking at diversifying the eligibility rules or the types of benefits that are available. So it's great to see, a lot of health systems have these benefits in place. Then also what they're modifying in those within those benefits. And then what I really like to look at as we're thinking about forward-thinking strategies is where are organizations focused in terms of where they want to move forward and make some changes. So some here that I've pointed out for reference: enhanced behavioral health, going beyond the traditional employee assistance program or the medical carrier in terms of the mental health services and network that's available, really thinking about what can we do beyond that to help support our employees. You saw that mental health access and support was at the top of the list in terms of healthcare employer concerns. So that's an area where we're seeing a significant portion considering making additional changes. Student loan restructuring and repayment programs is another great area that we have seen continue to go up in prevalence. 44% have it in place. Last year it was 39%. So we continue to see that go up. But look at the percentage that are considering putting that in place or making modifications to it. So that's definitely an area of interest for a lot of health systems, especially nonprofit health systems that can also take advantage of really tying that to the public service loan forgiveness opportunities that employees have as they come into the healthcare workforce and have a lot of student loan debt from both, undergrad as well as graduate school and medical school that they need to repay. Some of the other areas that I want to point out in terms of areas of interest: paid caregiver leave. While only 19% of health systems currently have paid caregiver leave as an option within their organization, you can see another 28% are thinking about putting something in place here that, again, really hits on the issues around the fact that your caregivers who are providing support to your patients are also caregivers at home too. So whether that's for children or for elder care, that they need that support as well, potentially, to make sure that they're both thriving within the work they provide, but also at home. And then another one to hit on related to that flexibility of benefits that Frank mentioned: lifestyle spending accounts. You may have heard this term come up in the last couple of years. It really hits on that flexibility of, like, somebody wants to choose what's important to them and what's relevant to them and spend their dollars related to that. So only 3% of health systems have something in place that comes in the form of a formalized lifestyle benefit program where they can provide like a fund of money and people can choose what they want to spend that towards. But 33% of health systems are thinking about this, really going, again, in line with what we were talking about before, that people are looking for opportunities to provide that flexibility, what's important and relevant for each person, so that they can choose what's most valuable in the benefits package and offering that's available. And this sort of ties into, how our health systems hitting on the benefits as it relates to the diversity of their workforce and making sure that their benefit strategy is aligned with their DE&I initiatives. So you can see at the top, accessibility of benefits is top of mind and something many health systems have focused on and put in, especially since the pandemic. Virtual care became a tried and true sort of way to make sure people had access to resources and healthcare services when they could not access in-person care. But affordability is next in line in terms of, and especially supporting low-wage earners. And I'll walk through some of the tactics that health systems have put in place or are contemplating putting in place to help address the affordability of care. And again, it hits on that top concern Frank mentioned, not just the rising costs for the health system, but rising costs for employees as well. Another area where we're seeing more and more interest, where I think health systems have traditionally been a little bit slower to adopt compared to other employers in the market, in terms of corporate employers, thinking about diversity and family building options. So really expanding and modifying fertility benefits that are available through the medical plan, or even with supplemental services and providers like Progeny or a Maven, and having that enhanced network of providers that can provide fertility support. But then thinking about the equity of how, how somebody can build a family, thinking about the funding available for adoption or for surrogacy, because those are all areas that can help somebody in a different situation build a family beyond fertility benefits as well. So just some examples there of how health systems are thinking about their diverse workforce and how benefits can play a role in their DE&I strategy. In terms of the supporting low-wage earners, we are continuing to see every year an increase in looking at how payroll deductions, what employees pay towards their health plan, is segmented in terms of, a low-wage earner potentially making $35,000 or $40,000 is going to pay less towards that same plan option as somebody making $150,000 or $200,000, and really segmenting the equity in being able to access the same level of benefits, knowing that they're paying a much bigger portion of their overall income towards benefits. So that's an area we continue to see increase in terms of prevalence, that salary banding in terms of the contributions, but also through plan design. That's another area that we're seeing modifications being put in place, where we saw a much lower prevalence of that in past years. So what you pay for your deductible or copays, that can be segmented to low wage earners are going to pay a lower out of pocket through their plan design versus somebody who makes more in terms of income. We're also seeing more focus around, concerted effort around employee financial needs programs. One thing that we always talk to health systems about is as there's more and more of an interest in putting in high deductible health plans, which in the past health systems were not as big offerings as other corporate employers for offering those. It is definitely, a competitive way to help address some of the highly compensated employees that want to have that tax savings vehicle. But we also want to make sure that employees that are low wage earners are appropriately supported if they're going to be going into that program. And choosing a high deductible plan, that they have the appropriate support for financial needs. We ask health systems to look at their own, bad debt and charity related to their employee population to make sure, are their own employees potentially going into debt inadvertently because of, payments that they couldn't make towards their deductible or co-insurance through their plan design. So it's really important as we work with health systems to be very mindful about how they're approaching their strategy around financial well-being. And when they do offer these medical plans, that low wage earners in particular have the right mechanisms to choose the right plan that won't put them in a precarious situation to be in debt or potentially avoid care because they can't afford it. Last, from my perspective, I definitely wanted to also hit on, second in line in terms of what we saw for top healthcare concerns was around burnout and workforce resiliency. Now, we know burnout is addressed in many different forms because it's not, it's not a one-size-fits-all solution, but it's also not a one-size-fits-all in terms of root causes, right? There's many reasons there's burnout that exists within an organization. There's operational demands and pressures in terms of what has sort of formed in terms of administrative burden that comes with being in the healthcare industry and the role that physicians and nurses play and administrators play. But there's also the lack of and support around having access to mental health providers, or even the stigma around accessing those providers. And that has exacerbated burnout. And then obviously we saw continuous increase in the level of burnout with populations as a result of the pandemic, and just the sheer hours and efforts that all of the clinical and administrative workforce had to put in to support patients and make sure that the health system could continue to operate. So I'm going to hit on a few examples of what health systems have put in place to help address burnout from the different facets, right? So emotional well-being obviously is a very critical area that can help support and mitigate burnout for employees thinking about supporting mental health. So making sure that resources are highlighted and really brought forth and emphasized. We saw that go up in terms of even well-being priorities. It was always physical well-being at the top, then emotional well-being. That actually switched places in our survey this year. So that has become top of mind. But then thinking about how do we support managers better and make sure that they know how to look for signs for burnout? How do they get people into the right resources when someone's experiencing burnout? How do we improve workflow efficiency? That's an area, well, we know some groups have some set strategies around it. We know that can continue to exacerbate burnout. So that's an area that we see continuous focus on. Peer-to-peer support programs is another one where while 33% have maybe a formalized program in place, others are thinking about putting something in place because a nurse will want to talk to another nurse that potentially understands their specific concerns and the role that they play within the organization as well. And they'll have unique issues and barriers that another person, a counselor that's coming outside of the system may not be able to address. And I wanted to hit on also a custom EAP for clinicians. So nurses, residents, physicians, they have a very unique experience in terms of how they're supporting patients, even some of the, the things that they have to deal with outside of the work that they do within the system. And so, organizations are thinking about how can we customize some assets or aspects of our employee assistance program, specifically to address the barriers and the issues around burnout that they deal with, the clinicians deal with. And so looking at ways to partner with the EAP to enhance the approach. It could be a concierge type service. It could be adding more trainings to support those physician leaders and nurses so that they can look for signs of burnout. There's a lot that they can do to really enhance the experience, particularly for clinicians, which experience, a really different aspect of burnout than I think the rest of the workforce has dealt with as a result of the pandemic. So again, no one size fits all solution there, but many options to think about of what health systems are doing.
So as we think about many of the areas that Sheena was covering, and going back to some of my original comments, that on average, 2/3 of the services at health systems are delivered within the system. And certainly there's a lot, we know other large component where it goes as high as 80%. So when you're looking inward, it's important to understand certain things as you think about access and affordability, and be able to meet the needs of your employees, especially around some of the areas that Sheena was just covering. So, where are the areas? This is the business side meeting the objectives of the plan and their dependents. So, certainly a big area. We've seen a large across the board, utilizing telehealth and virtual care really is, and that's been entrenched for the last several years. However, there are many other areas as well. So we've seen a big uptick in identifying, non-affiliated providers, especially for the domestic tier. So typically, the domestic tier is going to afford the member, the lowest out-of-pocket expenses. Normally going from tier 1 to tier 2 to the non-domestic providers is substantial. $1,000 difference in deductible, additional 20% co-insurance. So identifying providers, and there are ways to test for this. Do you have the right complement based upon where people live and the availability of actual open practices? As we think about also, as commuting radius has gone up due to hybrid work, or having the availability of an extensive network for your remote workers. But then I think about expanding domestic tier. Behavioral health is by far the biggest the biggest area where we've seen that expansion. Other areas, requesting of the practices, access is probably one of the biggest feedback that the HR department gets back, is that it takes us the amount of time to gain certain appointments. So we've seen things such as extending practice hours for the employees and their dependents, setting up dedicated slots, having a formal way that the employee health plan and the physician organization, monitors, twice a year, let's monitor the physician capacity. What do we need to add, or in fact, partner with external vendors, be it that for telehealth or urgent care or behavioral health, et cetera. So really seeing the evolution of the plan to be able to meet the needs, again, to address access. And then quality, there may be certain specialties that are simply are not from an efficacy perspective, the ability to deliver based on others in the marketplace. And again, wrapping in the affordability, every time you send someone to that non-domestic provider, in most cases, it becomes extremely unaffordable for a large percentage of your population. So as you think about meeting the needs and looking inward, but also what are the things that can be asked of the business, to meet those objectives as well. Okay, so as we think about 2024, what are the ways our 2023 report will be released later this month. If you have questions, please reach out to us, regarding the survey and the information that we provided today. You will receive a recording of this presentation. And if you're interested in receiving the full 2023 report and you did not participate, please contact us as well. As well as, as we prepare at the beginning of next year to launch the 2024 survey, if you're interested in joining and getting the benefits of having all of the information, please let us know. The members of the survey, even with the depth of the information, we do not charge for it, but in order to receive the survey, you have to participate. So providing this information, but again, we really do this for the benefit of our clients and also of the industry, and utilize our the members of the survey to really drive things forward from the industry perspective.
All right. So thank you. We'll pause here and see if there's any other questions from the Q&A. I don't see any. We must have answered every question.
And you provided your direct contact. So.
Yeah. All right, then. I guess if there's no questions, we could share this recording, and you have our contact information, and you can reach out to us regarding the report or specific information that we shared today. And we're looking forward to having the final report released later this month.
Thank you, Sheena. Thank you, Frank. Incredibly valuable information you just shared with the group. I can't wait to share this with all the attendees. Appreciate your time and everyone else's for joining us. And I hope everyone has a great week.
Thank you.
Thank you.
Thanks.
Bye now.
Bye.